Pulmonary embolism is very common in both inpatient and outpatient settings. It should be one of the first considerations when a patient presents with acute onset dyspnea, shortness of breath, and chest pain. Other common symptoms include cough, hemoptysis, diaphoresis, and feverishness. A pulmonary embolism is an abrupt occlusion of the pulmonary artery and/or one of its branches. The occlusion may consist of blood clot, thrombus, air, fat, or malignancy, tumor, originating in another part of the body, which dislodges and travels through the venous system to the right side of the heart and thence the pulmonary vasculature. In most cases, pulmonary embolism arises from deep vein thrombophlebitis in the lower legs or pelvis, following trauma, surgery, infection, or an acquired hypercoagulable state. Behind only stroke and coronary artery disease, pulmonary embolism is one of the most common types of cardiovascular disease. It is more common in patients 60 to 70 years of age, with the highest incidence in patients 70 to 80 years of age. Although death following a diagnosis of PE is relatively common, as high as 30%, many of these patients have coexisting serious conditions, such as cancer, recent surgery, or sepsis. The direct mortality associated with undiagnosed, untreated PE during the course of diagnosis and treatment is about 5% to 8%. In initial evaluation, vital signs such as blood pressure, heart rate, and rapid estimation of oxygenation by pulse oximetry are critical to assessing severity of vascular compromise and the stability of the patient. Arterial blood gas testing will confirm if a patient has hypoxemia and can be used to obtain the arterial alveolar gradient to determine if there is a pulmonary embolism or other VQ mismatch. In practice, clinicians tend to overestimate the probability of pulmonary embolism. The Wells criteria and the PE rule-out criteria, PERC, assist clinicians with determining clinical probability for pulmonary embolism. One of the important criteria in the determination of pulmonary embolism is if there is a more likely alternate diagnosis, and this is somewhat subjective. If the Wells criteria are used, a score greater than 6 is considered high probability of pulmonary embolism. 2 to 6 is moderate probability, and less than 2 is low probability. A modification of the Wells criteria simplifies scoring to either likely, greater than 4, or unlikely, less than or equal to 4. The PERC rule includes 8 criteria: age younger than 50 years, heart rate less than 100 beats per minute, oxygen saturation of at least 95%, no prior deep vein thrombosis or pulmonary embolism, no unilateral leg swelling, no hormonal estrogen use, no hemoptysis, no history of surgery or trauma requiring prior hospitalization in the previous 4 weeks. If all 8 criteria are fulfilled, the patient's risk for pulmonary embolism can be considered sufficiently low, and further testing is not necessary. The mainstays of initial pulmonary embolism management focus on rapid assessment of clinical severity and stabilization of the patient. The initial goal for the patient with pulmonary embolism is to maintain oxygen levels. In selecting initial pharmacotherapy, European guidelines and a 2022 clinical practice review recommend that treatment be guided by risk stratification of pulmonary embolism as high, intermediate, or low based on the patient's clinical presentation. Pulmonary embolectomy is indicated for patients that have high or intermediate risk pulmonary embolism with contraindications to thrombolysis. When possible, patients at assessed low risk for complications, minimal risk of pulmonary embolism-related death, should be discharged from the hospital and continue to receive treatment at home. Pulmonary embolism is a common cause of acute onset breathlessness and chest pain, often confused for many other diagnoses. It should remain on one's clinical differential due to the fact that it can be life-threatening and is treatable if caught and managed early. A variety of treatment options are at the forefront for ensuring that patients are given the best possible outcome. Learn more about pulmonary embolism at netce.com.